Hello, sir. Good morning. How are you?
Good morning. I'm fine. How are you?
I'm doing good, sir. Thank you. How's everything? How's your clinic?
All good, all good. Yeah, congratulations on clearing your license exam for USA.
Thank you. Thank you so much, sir. Soon, I hope to see you here soon.
Yeah, definitely we'll try and we are on top about it. So
Mm-hmm.
definitely we will be.
I I hope you're doing okay because I know we had to postpone the lecture from last week because you were not
Yep.
feeling well. I hope you're doing okay now.
Yeah. All right. I'm fine now.
Oh, that's good to hear. So, let me introduce. We have a founder, and he is the CEO of ARFA, and he has his own institute. He's been invited on so many talk shows, and one of the aspiring PTs in India, especially he has so much name in Pune. I myself took so many workshops. I remember, I feel like a kid when I used to come to your workshops. I've done every workshop you name it, and I've done it with you. So it's so good to see you and have you here.
Same here, dear. Same here.
Yes, sir. So tell us, what do you think about health? What is the definition of health according to you? Health,
So
fitness,
actually, yeah. So if we talk about health is something we know the definition. It's being about being well and free of illness,
right?
right? And when we consider fitness, it's about being strong and fit. So if I say health is first it's a process. Being healthy, you need to be literally fit.
Mm-hmm.
Okay, so wellness, if we talk about fitness, it's about wellness also. You need to work on improving yourself daily, and that's an investment. In terms of it could be exercise, it could be yoga, it could be any form of exercise, plus over the diet and nutrition as well. So yes, that's how it is.
So tell us more about ARFA. I want to know what ARFA is, how you started it, how you got it, what idea did you have in mind?
So actually, to be said, I am an accidental physiotherapist. First of all, I the word accidental I came across when our Prime Minister Manmohan Singh became an Prime Minister. There was a lot of loud shout that he's an accidental Prime Minister. So I was like, yeah, even I'm an accidental, not. Um, uh, I still electrotherapy.
So we lost you.
Can you
Yeah,
hear me now? There,
now it's
there
good.
was there was a call. Actually, I disconnected it.
Oh,
So we were learning, electrotherapy, and I still remember we were studying conduct valves and everything. I was like, am I going to be an electrician? Later on, so like there was a query. Still, I remember I didn't knew the passing marks also in my first semester. I was that kind of jolly person. I was not even serious about studies, but and it's all I was lucky enough to have good friends, good seniors who helped me to get. And it was a very tough journey to become a PT. From MEHs also, because I think it's and we from MEHs. So that's how I became a PT, and later on that there's a code like you do what you don't like actually in your life. That's how you happens to be doing. That's why I was never interested in studying. I was somehow uh, finished my degree later on. PT, I was not interested in practicing, but I was very much interested in learning things like neurology, anatomy, gynecology, but not PT management. Later on, while just in my final year on internship, I used to discuss with my friends. I used to teach my juniors also. I used to share notes. thought that, I am little bit improving in teaching also. Uh, Thought so that in my mind, I always had that since childhood that I will be opening an institute, and still I discuss with my friends that we are planning to open school also, probably institute also. I got an idea that this could be done being a physio also. So that's how, with the idea, with my friend's suggestion, and Dr. Dolly Bhatia, Dr. Shefali Mehta, Dr. Madison, all these friends, they recommended that you go ahead with the academy, and that's how it started in 2016 ending, I guess.
They're all my seniors from DY.
Yeah, these were my very, very close friends, and whatever I have achieved till now, all the credit goes to them.
Yeah, I remember Dolly ma'am, Madison sir, everyone. They're all my seniors. I was in second year, third year, and they were doing their masters. I used to look up to them. It was a very fun batch. So
Yeah.
yeah. So if you were in Diva, you would be my senior too.
Yeah, probably I had given an exam, but I didn't join
So that's
because of some.
I,
Hmm,
I love the fact that you pointed out that PT is so difficult. Everyone thinks that people who couldn't take MBBS, who couldn't be doctors, they just choose PT. But PT in itself, PT school is so difficult. No one knows the journey. We study so much. We have such tough practicals. We have to learn
definitely.
pharmacy, surgery, everything in detail. So it's really pretty difficult. It's not what the notions that everyone has that PT is easy and everyone can do it. It's not true. Thank you.
It's not because we definitely because we rely the least on investigations, we rely the least on the technology,
Hmm.
and that's why we are called as having a magical hands. Okay, so it is said to be that physiotherapists have an eyes on an X-ray. You have to evaluate with hands, you have to treat with hands, and we are the one of the profession or PT practice in such a way that we are treating the root cause.
Correct. That's so true. So our Maggie is, I've heard that our Maggie book is so inspired that now they're gonna start using it for MBBS too, because our tests, our special tests, they're so unique and they're so much in depth. I could never finish reading the whole book.
Yeah, definitely. And it's very, very, very interesting. It's very skillful having a special test. I think what I said, we are using hands-on
Mhm.
for diagnosis also. That's a special test. We use the most as a physiotherapist, as an orthopedic physiotherapist also.
Mhm. So can you tell us more about your skills like dry needling, cupping, Pilates? Well, what are those skills and how important do you think those skills are in a PT's career?
I think learning skills is very, very important for an upgradation. All the fields are improving these days. These are all trending treatments. These are all pain management techniques, and whatsoever how you want to use it.
Hmm.
Taping, it is all the techniques which is going to help you to manage the condition. Plus,
Right.
but this is techniques which we use it as a tool. But as a clinician, as a PT practitioner, we have to combine it with physiotherapy,
Hmm. That is so well put.
physiotherapy treatment. Yeah. And also, dry needling, taping goes with the evaluation, how you evaluate, what you want actually. That goes when you learn taping, when you learn dry needling. Apart from that, we learn cupping, we learn Pilates. So Pilates is actually the core rehabilitation. And as I say, I always keep on core of physiotherapy also. Your next question, which we have already discussed, we have already seen what is the best skill to be learned. When I say the it's a core of physiotherapy, the point comes is like posture. We just I told you that we are treating long term rehabilitation. We are trying to achieve long term. Everything depends upon the posture. Everything depends upon the I mean, whenever we are working on long-term rehabilitation, we have to improve posture. So Pilates is a concept which I say it's a core of physiotherapy. It is something, a tool, a technique which everybody should learn. Not, I mean, it doesn't look fancy, but it's actually core, of physiotherapy rehabilitation.
Hmm.
So everybody should consider learning Pilates also. Apart
I
from that, yeah,
I was I just finished an interview last weekend with one of the aquatic therapists from Germany, Dr. Uwe, and he was telling me how his studies showed that combining therapies, multiple therapies, and using them in your practice has more results than just doing therapy. So his concept is of combining the aquatic therapy with land therapy, and he has had double the rate of recovery that we normally achieve. I was so fascinated by those studies. And I think it goes the same with us when we start taping and then we do strength training. There are better results, there's better stabilization. And
definitely.
right. So, what is one good posture exercise that you would recommend for a good posture?
I think one exercise, if we talk about the name, I don't know, many people will be familiar or not. Depends upon the case also. But if we talk about simply about the low back, okay, low back posture is the most which is influenced. And these days, if we talk about, it's about neck syndrome also, upper cervical posture.
Right,
I will say that strengthening the lower back.
right,
There is one exercise which is also called a static core, the most simplest exercise which everybody should do. And I'm taking this name because everybody is familiar with this name. Apart
right,
from that, there is exercise which is called as hip rolls
right,
is the one exercise.
right.
We have cat stretch, which we give it as cat camel.
Mhm.
It's different from cat and camel. This is called as cat stretch, which combines the exercise same as, but which has have an efficient core engagement. So I'll say that whenever you're strengthening, it's not about the condition. We have to go specific when we have condition. But when we talk about health, you have to consider Pilates. And in this exercise, it combines for the whole core set. That's whole core. Whole core means lateral abs, anterior and posterior, everything. So you have to work on these, at least these exercises. Apart from that, if you talk about the upper body, I mean, those who are familiar, they should strengthen lats plus dorsal because
Mhm.
that is the muscle which is very much underdeveloped, which is the cause of having recurrent trapezitis or upper neck pain, and which influences the posture later on. That's where we have rounded shoulder, that's where we have hump, and what's or not.
And that's so specific because I myself I jump into strengthening trapezius, scapula, the protraction, retraction, that's all. And I'll limit. I never think about going to lat dorsi. That's a good suggestion. I will myself consider it and start practicing it. So, you have a certification in diet and fitness as well. What is your favorite food that you recommend would be healthy but tasty?
I'll say that, see, I mean, there I used to keep on saying in my UG days that people used to say that I am a pure vegetarian. I used to say that I'm a pure non-vegetarian. So for me, just to detox my body, I used to have vegetable salads. So that's the most beneficial thing to detox our body, to cleanse our body. Kind of, you involve all the vegetables into it, and that literally feels you lighter. That activates your, propulsive movement. You have good digestive process. So that's how, in between, I have these kinds of salads to make myself fit, and that's what. And being a physio, I can't have tummy. Being a Pilates instructor, I can't have a tummy. So in between, I drink a lot of water.
Mhm.
So that's what I follow.
Right, hydration is the key.
Yeah.
Yes.
Yes. like I will also I will elaborate these days
Mhm.
people use a lot of mobiles, people don't sleep at time. A lot of people who have been overweight, for them, I'll suggest that sleep on time, eat on time,
Mhm.
and drink a lot of water. I mean, this is the main factor. This is the main cause of having, getting obese these days.
Correct. I agree with you. Sir, who has been your role model in your journey as a PT? Who has always inspired you and for you to become a better PT?
Well, I will say that there was a struggle in clearing my PT. After that, I when I started, I was like, there should be a goal that how you want to be.
Mm-hmm.
Uh, First, I got interact with Dr. Raisri, Dr. Shubhanjan sir, Dr. Ejaz Ashai. These are all actually who have been doing a great in their career. And if you see that, how the face of physiotherapy should be. So I'll say that, Dr. Ali Irani, Ali Irani sir, who has given, international fame to a physio fraternity or what physio is actually. So definitely my journey is towards becoming better, learning more skill. Because if you see these instructors, these teachers, these practitioners, you always feel that you still need to learn a lot of technique to improve yourself. So definitely these are actually my role model, and I'm trying to get better every day.
Yes, sir. So we are all trying. That's the goal, to be better each day. So what are few failures that you experienced through your journey?
Well, when I talk about the failure, this is actually it's not about always failure, but because if we consider failure, we end up sitting at one place. I'll say that it's actually learning and rethink about the process, how we have been, and improve that process. You know that since down the line 5 6 years, if we see the clinical practice was something, and the perception of physiotherapy was very 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 different.
Correct.
You Since we belong from the same area, that's Pune and PCMC,
Mm-hmm.
the perspective was about it's a massage, it's a kind of treatment which is kind of yoga. So perception was like this.
Right.
So that's what I thought that this is something which is actually critical to work on. That's where I suggest everyone. So this is something which kept me demotivated. But that's what I say to all the physiotherapists that learn more and more skill, which will make your work look skillful, because that will improve the point of contact. You might be first point of contact for, because that's what. So if I give you an example, that cupping is trending.
Right.
It's very much trending treatment these days. Now, you uh, uh, if you promote cupping, people will come to you not for physiotherapy actually, but at least for cupping. So that's where you can explore. You will have a good flow of number, and it's not about only cupping. You can learn any of the technique which will get a good flow in those areas. Mainstream practice will be physiotherapy, okay, and then you can explain them. You can get explain what is the, and talking about the condition, explaining about the condition makes you a better medico. Okay, so that's what I how to tackle. I believe that this is something uh, I felt that is a failure, but this is how I felt that we can tackle like this in this way.
Correct. True. I agree with you. So talking about that, what would be one piece of advice that you would give to our generation who are trying to start their careers as PTs or as just to be skillful, to be better at what they are doing right now?
So say for our generation, again, I'll say learn a lot of new techniques. It's not only you can say old school of physiotherapy is going to old school of physiotherapy practice is going to help you in this. Things are getting competitive, but it's the same time that we have so many resources available to learn. Okay, get the basic concept clear, and most important thing is there is a lot of still what is what do, if I ask you one question, who is as a non-medico, if you go to a doctor, who is a better doctor for you?
Like a primary care practitioner, just like a physician.
No, I'm asking you the question where, so if you're visiting two doctors for an orthopedic knee pain,
Right.
okay,
Okay.
both are recommending same medications. Who is the better doctor for you
Uh, uh,
when you interact?
when I interact, the one who has more knowledge, who has more technical skill.
Exactly. So I'll say that, see, techniques and all doesn't matter for the patient.
Correct.
Treatment does.
Right.
But for those who since there are medical languages, which is something makes us difficult to convey what actually the condition. I'll suggest every physio to improve their talking skills, communications.
Correct.
For all the patients, the good medico, the good doctors are those who can convince them or who can explain their condition, what it is actually, rather than only prescribing the
Right.
treatment. So communication skill is very, very important. The more you talk, the more you are close to the patient. And also it is said that the more the patient knows about his condition is the half treatment.
Correct.
So if you have a patient of headache or neck pain, everybody will put him on an traction machine, on IFT, TENS, mobilization. That's something which everybody do, right? But if you could explain him in a better way, you are better than anyone. You are better than any of the
Mm-hmm.
doctors. So I'll suggest that will be also by
Right. But I agree with you. Talking about communication skills, yes, I got you on back. Talking about communication skills, I have in at my clinic right now where I am practicing, I have small modules. Like I have the models, especially for knee, for shoulder, for hips. So whenever the patients come in, it's an orthopedic setup. Whenever the patients come in and they ask me questions about what's going on with their body, I usually tend to explain them with the help of diagrams or
Can you hear me now?
yes, yes. I
I'm
am so
so
sorry.
sorry.
Cut off. It's better now?
Yeah, better.
Okay. So I was saying that, like talking about communication skills, I have those small models of knee and shoulder and hip at my clinical setup where I'm practicing. And whenever the patients come in, like they get their x-ray reports or they'll come ask me, oh, what's ACL? And, or I have quadriceps strain, or I have arthritis, explain me. I will bring out the model. I will explain them where the ligament is, what's going on with their bone. And like you said, they don't want complete history of it, but just a gist so that they feel satisfied. And just to communicate and tell them, this is what you have, but this is how we're going to strengthen it. This is how we're going to improve it.
And
So
why
you
why do we need to strengthen actually?
correct, correct. You gotta explain like if this will remain tight, this causes pain. Well, most of the pain is tightness. You give them two stretches over 2 weeks, and there's no more pain. It's really magic. So, but then they're like, why am I holding this rope and stretching my hams? What's the use? So every time they come in, they're just stretching. So you have to explain them. You have to tell them how you have to be patient, and that's how it works. Yes,
Right.
sir. Sir, I will not take any more of your time. I know you're getting so many calls, but you removed so much time for me. Thank you so much for joining me today, giving me so many tips and tricks, and I will stay connected with you. I'll surely drop you a text and we'll see. But thank you so much for being a part of this show and giving us so much knowledge.
Pleasure.
Yes, sir. Sir, any last words that you would like to say?
I'll say that, since you're promoting health and fitness both,
Mm-hmm.
I think I'll suggest all the physiotherapists, first of all, improve your skill. Okay.
Mm-hmm.
Talk more about the condition,
Right.
learn more skill, plus invest daily time for your own exercises,
Right.
read something new, okay, because and the benefit of making the things understand will increase your confidence in the teamwork also,
Mm-hmm.
with the surgeons, with the other paramedics, with the doctors. Okay, and that's where it is also a contribution to the physiotherapy, that what actually physiotherapy is for the other medicals also. So
Right.
this will be the suggestion for all my juniors.
Thank you so much, sir. Thank you for your time. I hope you have a pleasant day and
Thank you, and wishing you a very, very lovely career in USA. And we'll be, seeing you soon. If you're coming to India, we forgot to meet you last time, but we'll be connecting with you soon, dear. It
yes,
was lovely talking to you, and have a great day. We'll
thank you
connect
so
on.
much. Okay. Bye bye.
Yeah. Bye.
Bye.
Take care.